A lot of misinformation or confusion is really what it's about over how many pregnant women should get the vaccine has been out there. There is a clear message, though, from the CDC with an urgent warning for expectant moms to get vaccinated or you could face a higher risk of death. That's such a stark warning. That's not just for the mom. Remaining unvaccinated could negatively impact the health of unborn children, according to the CDC. And this comes after 22 pregnant women died from the virus last month. I want to say that 20 of them were in the state of Texas. Is that correct?
That's correct.
Wow. Dr. Lauren Streicher is here, clinical professor of obstetrics and gynecology at Northwestern. Thank you so much for being with us.
You're welcome.
Okay, so the last time we talked, we discussed those women passing away. Just so staggering to think that people are dying and it was completely preventable. But talk about the risks to women, or if there is any risk, because I think a lot of people are fearful, but for no reason.
That's right. And you said there's a lot of confusion about the vaccine. The confusion is only on the part of the general population. There is no confusion in the medical world, which is why the CDC, the World Health Organization, the American College of Obstetricians and Gynecologists, they're not just suggesting it or saying this is a good idea or maybe talking to your doctor. They come out very, very strongly in saying, look, there is a 70% increased risk of dying if you get COVID and pregnant. You are 3 times more likely to end up on a ventilator. You are far more likely to have a pregnancy complication. So it's not controversial at all, but women are confused.
You know, we think about those who are immunocompromised, those who are at higher risk, as people who are already have an underlying condition. Right. But when you're pregnant, isn't your immune system compromised for the sake that you're actually helping carry a second life?
That's exactly the point. Did you say why? Why would these young, healthy women get so sick? And the reason is that the immunologic system changes in pregnancy in order to bring this baby on board without the baby getting rejected. So we don't know exactly, because of course the virus hasn't been around long enough, why it is, but we know that it is happening. And as you said, these women are dying in unprecedented numbers for young women. There has been 22,000 women who are pregnant with COVID who've been hospitalized, most of them on ventilators, essentially all of them unvaccinated. So the message is loud and clear. Right. Get vaccinated, get vaccinated.
One more question, we only have time for that, is the babies.
Yeah.
How could this shot, how could COVID-19 vaccine affect babies long term? Because I think that's a concern.
Well, what we know, first of all, is that there's actually protection to the baby if you get vaccinated. There's 2 studies that have come out recently that show that if a woman gets vaccinated, particularly in the second half of her pregnancy, 100% of those babies have protective antibodies that last in that vulnerable first few months. And we know that there is no risk. There has been no increase in birth defects, preterm labor, any pregnancy complications. So most women think, okay, in an abundance of caution, I don't want to do something that might hurt the baby, so I'm not going to get vaccinated. It's the opposite. The abundance of caution is to get vaccinated, not only to protect mom, but also to protect the baby.
Dr. Streicher, thank you for breaking it all down for us and making it crystal clear.